All right, today our viewer question is, what are your thoughts on vegan protein powder?
Well, vegan protein powders, I suppose they have a little niche somewhere in a healthy nutritional program, but you really shouldn't need these. Why? Because a whole food plant-based diet provides all the protein that we mammals need. Ask any buffalo, ask any giraffe, ask any elephant. The protein grows out of the ground in the plant. Ask any gorilla. And no one really needs it as long as you're consuming a diet based on whole plant foods, because all plant foods have protein in it. And if you are eating 2,000 calories of whole plant foods, you can't help but get 50, 60, 70 grams of high grade protein or more. An extra hummus sandwich or an extra helping of lentil stew, boom, there's another 10 or 15 grams of protein. How much do you really need? The U.S. Department of Agriculture, 50 grams for women, 60 grams a day for men. But this is calculated on a huge surplus that will meet the needs of absolutely everyone. The truth is, we Homo sapiens, how much amino acids do we really metabolize over the course of it? It's about 20 grams. You don't need very much, the truth of it is. And so even the 50, 60 grams that are part of a whole food plant-based diet, even that's a huge surplus. So given that, you now need to take the protein out of peas and rice and potatoes and concentrate them up and add an extra 30 grams of protein to your smoothie. Is there any real advantage to doing that? Instead, there might be some folks who benefit, those people with digestive problem, have Crohn's disease, or intestines that aren't absorbing their nutrients so well. Maybe people recovering from burns, especially in the upper part of the body. They're having trouble swallowing. A smoothie with some protein powder might help. I've got some really underweight vegan folks, really scrawny, skinny folks, and as part of their weight and muscle gain program, a protein fortified smoothie might help them. But again, just for 6 months or 12 months, while they're getting their musculature more toned up and putting on the weight they're looking for. Now, what's my hesitation? Well, it's an unnatural processed product, and it goes beyond philosophy. There's two things that have me concerned, especially when it's used in great excess. In other words, when we're talking about just an extra 20 grams, which is about all anybody should need, a couple of tablespoons of this stuff, that should be enough. But many people, if they're using, an extra couple of tablespoons, how about 50 grams, 100 grams? I just did a workout at the gym, 100 grams, man. That's what the bodybuilders want. Well, there's a couple of concerns about that. These amino acids, when they are in their refined form, leap into the bloodstream. In other words, now when you have a hearty helping of lentil stew or a bean burrito, the lentils and the beans in their whole form have lots of protein, but they're bound to the matrix of the lentil or of the bean. You chew it up, and it takes hours for your digestive enzymes to work their way into the lentil and the bean and start metabolizing the carbohydrates so the protein can be digested, and the the proteases get in to start disassembling the proteins. And as a result, the amino acids that make up those proteins get into the bloodstream very slowly and gently. One pass through the liver, most of them and the muscles. They're mostly taken out of the bloodstream. And that's what's supposed to happen. We're supposed to eat whole foods. Ask any gorilla. But these protein powders, nothing slows down their absorption. They leap into the bloodstream. Suddenly, you've got 10, 15 grams, 30 grams or more of lysine, arginine, tryptophan, and they go through the kidneys and they bang into the kidney filters. And this is a toxic state for the kidneys. It induces something called hyperfiltration. And it's like passing gear on your car. And it's okay to stay in it for a few minutes, but you don't want to stay in passing gear hour after hour. And you don't want to stay in this state of protein hyperfiltration. It damages the kidney filtration membranes. And people who consume these protein powders frequently in large amounts, I fear it may well be damaging their kidneys. And second, when we eat protein, those amino acids sweep up into the liver. The liver responds by putting out a gush of a growth promoting hormone called insulin-like growth factor 1, IGF-1. And this drives growth throughout the body. And it's fine if you're a 6-year-old child or a baby calf. But if you're an adult woman with a breast lump, or you're a guy with a big prostate gland, the last thing you want is a big surge of IGF-1 going through your tissues and promoting cell growth everywhere. And heaven forbid you got an official prostate cancer or a lung cancer or a breast cancer. These protein powders are not working for you. I fear that it increases the IGF-1 level and drives cancer growth. It's an unnatural product. And again, for limited time for weight gain and for tissue repair, okay. But again, just go through one can of it, but don't make this a regular feature of your diet. Don't see that, oh, that's my gateway to health. It might be your gateway to the dialysis machine. So easy does it on these protein powders. There should be, for a healthy person, there should be really no need to consume them. It comes from the old echoes of that primordial doubt when people hear you're a vegan. Oh, where are you going to get your protein? And people have this protein instinct. I better put some more protein in my diet. You really don't need it. Have another hummus sandwich. Have another scoop of beans stew and lentil chili or whatever form you enjoy your legumes, and keep your protein in whole forms rather than powders. And I think you're going to be way ahead of the game. Hi, everyone. Dr. Michael Klaper here, announcing our new format for our Q&A with Dr. K. Annie Hagen will be asking me one question that's been sent in by our viewers. So if you want to see if your question is getting answered, do join us for our Q&A with Dr. K right here. Hope to see you then.